Hello and welcome to this brand new series, Wellness Watch, a special show curated to ensure a healthy you and to acquaint you with a wide array of possible treatments and medical procedures India offers for various ailments. So let's embark on this medical journey, Wellness Watch, with me each week. I'm your host, Preeti. The well-being of any country depends on the health of its citizens. Over the last 8 years, India has taken significant steps to incorporate digital health at the core of its healthcare delivery system. The Digital India program has brought tremendous changes in the healthcare sector of India. Initiatives like Ayushman Bharat, Digital Mission, COVID app, Aayog Setu, e-Sanjeevani, e-hospital have made healthcare facilities and services reach every corner of the country. As India is the most populated country and an emerging economy, a solution for India might also be a model for the rest of the world to follow. Today in Wellness Watch, we discuss digital revolution in healthcare in India. And as we told you, over the past 8 years, India has been undergoing a monumental transformation in its healthcare sector, fueled by the power of technology. With its massive population and rapid economic growth, India faces unique challenges in healthcare, but thanks to the visionary initiatives, the country is changing how healthcare is delivered, setting the stage for a global health revolution. We get you more in this report by DT India's Harshita Oberoi.
India's healthcare sector is undergoing a digital revolution, with technology driving advancements in diagnosis, treatment, and accessibility. At the core of this digital revolution is the Digital India program, a groundbreaking initiative designed to harness the power of technology and make healthcare accessible, affordable, and efficient for everyone. Digital health, once a distant dream, is now shaping the future of India's healthcare landscape. Key initiatives like the Ayushman Bharat Digital Mission, COVID app, Aayog Setu, e-Sanjeevani, and e-hospital are creating digital highways that connect India's diverse population to essential healthcare services. These platforms bridge the gap between patients, doctors, and healthcare providers, ensuring access to care no matter where people live. The Ayushman Bharat Digital Mission is a game changer. By providing digital health IDs, it allows every citizen to access their medical history with just a click. This ensures better coordination and continuity of care, empowering both patients and healthcare providers. Another breakthrough is eSanjeevani, India's telemedicine platform. Through telemedicine, patients in rural, unserved areas can now consult doctors remotely, overcoming barriers of distance and connecting them to vital healthcare in real time. During the COVID-19 pandemic, the COVID app became a crucial tool for India's vaccination drive, enabling millions to register, track progress, and receive updates. It ensured that no one was left behind in the country's massive vaccination efforts. The Aayog Setu app was instrumental in helping India fight the spread of COVID 19. Through contact tracing and health monitoring, it empowered individuals to take charge of their health and helped prevent potential outbreaks before they could escalate. The UWIN portal, launched for the Universal Immunization Program, is another major advancement. With features like self registration, automated SMS alerts, and e vaccination certificates, it provides a seamless and digital way to track vaccinations for pregnant women and children, ensuring that no one misses out on a life saving vaccine. In an innovative step, India's Prime Minister Narendra Modi has introduced drone technology to deliver medical supplies and samples to hard to reach areas. By launching drone services at 11 tertiary healthcare institutions, the government aims to make healthcare delivery faster, safer, and more cost effective, especially in tough terrains. These digital innovations are not just about convenience, they are revolutionizing the efficiency, affordability, and accessibility of healthcare for India's vast and diverse population. But the impact extends beyond India's borders. As the world's most populous nation and a key global player, India's digital health model could serve as a blueprint for other nations facing similar healthcare challenges. Through these digital strides, India is not only changing the delivery of healthcare but is also setting the stage for a global healthcare revolution that prioritizes inclusivity. The digital health revolution is here, and India is leading the way. Harshita Oberoi's report for Wellness Watch, DD India.
India already has 400 million digital health users using available services such as telehealth, home testing, e-pharmacies and other digitally powered offerings. A study identified what drives digitized healthcare adoption in India, and it showed up to 65% acceptance of digital health solution among customers who use e-commerce services. Significantly higher adoption of digital health tools was reported by patients who had long-term disorders such as cardiovascular diseases, diabetes and hypertension. The pandemic catalyzed the adoption of digital offerings in healthcare. Having experienced the benefits of digitally enabled healthcare delivery, consumers now consider them as a necessity. Today, we delve deep into the progress India has made in digital healthcare and also the journey ahead. We are joined by guests in the studio with whom we will discuss some very important questions. We will be talking about what is digital healthcare. We shall also discuss what is the digital impact on healthcare. What is the status of digital healthcare in India? How is efficiency ensured in metropolitan and rural areas? And lastly, what is the future of digital healthcare in the country? As in every episode, we tell you how India has gained a stellar reputation over the past decade for providing high-quality medical services at affordable costs. India is leading in the adoption of digital health technology, with 76% of healthcare professionals in the country already using digital health records in their practice. In India, the government, under the leadership of Prime Minister Narendra Modi, has been actively promoting digitization of the economy to unleash and harness the nation's collective entrepreneurial spirit. The PM has highlighted the potential of telemedicine in the country. The overall goal is to ensure that digital technologies improve the life of every citizen, expand India's digital economy, create investment and employment opportunities, and also create digital technological capabilities in the country. So that was it when we talk of digital revolution in healthcare in the country. But to talk more about it and share more insights, we're joined in by guests in the studio. We're joined in by Dr. V.K. Paul. He's member Health NITI Aayog. And we are also joined in by Mr. Kiran Gopal, Joint Secretary, National Health Authority, Department of Health and Family Welfare. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Sir, we've given a detailed report to our viewers, telling them how digital healthcare has become popular in the country after pandemic. But Dr. Paul, I would want you to explain to our viewers in very simple terms what constitutes digital healthcare.
Well, thank you very much indeed. India has been a leader in digital public goods in every sphere. We are indeed a superpower in that regard. Our usage of UPI and our own IT strength and the progress that we are making in all sectors is mainstreamed and powered by digital technologies. So that's our strength. And in the space of health sector, digital technology usage has been there for a long time, and it's progressing, it's escalating, it's being made use increasingly every day. It has multiple dimensions. So you have covered very important dimensions. You talked about disease surveillance, Aayog Setu. We talked about facilitating vaccination using COVID, and now we are using UIN for our universal immunization program. You talked about e-Sanjeevani, the tele consultations. Let me also add that there are other dimensions. For instance, we use digital technologies for medical education, health professional education. We use multiple health professionals use multiple apps made in our own nation, which are helping them to perform tasks, to take decisions on patients, for example. That's an individual dimension where digital technologies are being made use of. But certainly in the larger space of public health, you have highlighted some of the areas, and if I just let you know the size of the digital technology, the size and the coverage and the impact that it has. Let me take example of e-Sanjeevani app, for example. Since it started in the wake of COVID-19 pandemic, we have used it for 329 million consultations. 329 million consultations. Yesterday, 300,000 consultations took place on a daily basis. And it has 16,000 hubs, 31,000 spokes, and so on and so forth. And you will hear from my colleague from the National Health Authority how, in a very systematic way, Ayushman Bharat Digital Mission is advancing the digital usage of all across the health sector. I also want to emphasize that in addition to the things that you'll hear from us in the public health space, there is a huge usage of digital health by the private sector, by the e-pharmacies, okay, and hospitals, private, trust, government, hospitals in our own ways. So we are witnessing a revolution in the health sector through digital technologies. We believe India has a leadership role globally. I have no doubt about that. It is our destiny to be in the top leadership in times to come as well. We were instrumental under G20 negotiations to be able to establish the global hub, global initiative on digital health also. So in multiple ways, India has a leadership, and for the international viewership, I would like to say that we have a lot of offerings to make. We can get into some details in the later part of our discussion. But indeed, India's healthcare revolution, health services penetration, access to healthcare is very ably being powered by digital technologies.
Right. I'll take that forward to Mr. Kiran. When we're talking of the timing of digitization of healthcare, it was COVID when it changed the world, and also given this the magnitude of healthcare in the country, it was indeed needed. Get us more as to when we talk of its implementation, when we talk of the very idea of initiating digitization in healthcare, talking of the timing as well. When and where was the need for healthcare to be digitized?
Thank you so much, and that's a very, very valid question. But I'd also like to point out that digitization in healthcare was even before pre-COVID times. Okay. For example, if you look at the National Health Mission, which provides primary healthcare services across different gamuts of the healthcare spectrum, we had applications like RCH, the reproductive and child healthcare. There were applications called Anmol, ANM Online. This was perhaps one of those beautiful applications that at the field level empowered the field level worker, the auxiliary nurse and midwife ANM, to do whatever work she was doing of gathering information, gathering data, tracking patients, tracking pregnant women and children through the use of mobile applications on a tablet. Even other programs of ours, the IDSP program, the Integrated Disease Surveillance Program, was also a digital program where data was collected from the field in a digital manner, and it was used for understanding the spread of various diseases. So while this was the core focus and programmatic interventions were mostly were done during pre-COVID times, after COVID and with the advent of the Ayushman Bharat Digital Mission, a new paradigm has come in, that is of putting the citizen at the center. So when we say that the digital mission is trying to create an ecosystem, digital health ecosystem in the country, the objective is to provide access to quality healthcare while ensuring that the privacy and the confidentiality of the citizen are maintained, plus the citizen has access to his or her health related information at a fingertips in digital format, in a smartphone, and they are accessible easily by the doctors so that they can provide better quality care now, because now they have access to the full history of the patients. So the transformation, I would say, we started digitizing. In fact, IT has been our
Right.
core strength.
Yes.
Like Dr. Paul mentioned, we are kind of a superpower in the IT world. The same thing continued in the health sector also, and we were digitizing in a big way our programs. Individual states also had have been running their programs. DVDMS, the vaccine management system, the drug distribution
Yes.
system. It is also one very good example. And then our entire vaccination chain, the entire vaccination chain, what you call the EVIN network, is actually a digital chain which actually makes sure that the vaccine available at the last mile is actually monitored, its expiry is monitored, its temperature is monitored, and so that the best quality vaccines are available in the field. So we have been doing it for quite some time now. Now, in fact, it is getting a much larger push given the success in digital spheres that we are seeing in other areas, especially in the financial sector. Something similar is expected to happen in the digital sector also,
Right.
with Ayushman Bharat Digital Mission being the orchestrator of creating this ecosystem. And finally, what in the approach that we have taken this time with the digital mission is we are saying that this can't be done by government alone. We are taking the private sector along.
Private sector along.
So this is a combined effort where government is creating the digital public infrastructure that can enable the creation of this ecosystem, and onto which both the government programs, government hospitals and the private systems, private hospitals are also coming and joining it. So this is a whole of government and whole of India approach that is going into the creation of this system.
All right, I'll take that forward to Dr. Paul. You mentioned the statistics, and this is indeed appreciative of the measures and the efforts which have been made by the government. I would want you to explain to us in detail, where are we standing on the global page? When we're talking of digitization of healthcare in the country, it is not just pertaining to, say, pregnant women, it is not just pertaining to telemedicine, but it is a wholesome approach which covers the entire healthcare in the country, penetrating to the rural areas also, penetrating to all age groups. So if we can have a UPI system that can be replicated in other foreign countries as well, in terms of healthcare on the global page, where are we standing?
I think we should visualize India's model of digital health driven by public health considerations and the access to healthcare in all its dimensions to a common citizen.
Yes.
Unlike the models in the West, where the emphasis is on hospital transactions and so on, our emphasis in the whole approach, and there will be other examples, you heard a lot from Kiran, and
Yes.
I also alluded to some of them, has been on public health, on individual centric, citizen centric, and not commerce centric, shall we
Commerce,
say,
yes.
or hospital centric, where perhaps other people, other nations may have more robust models. But our digital health mission is truly for the people, and it reaches every household and touches the life of practically every citizen. And that's where we are unique, because if we have to address big problems of the world, particularly the global south,
Yes.
we have those technologies and offerings for the world to take. For example, you heard about COVID app, the most
Yes.
famous one. No other nation at all, nowhere, that kind of a digital platform was available to track vaccination program, undertake vaccination sessions,
Yes.
provide certificates, provide analytics, and so on and so forth. Nobody was close to it, right? So we took that approach. Similarly, I give you another example of a public good, namely Portion Tracker. Portion Tracker is the digital platform on which we layer the information about growth monitoring of our children.
Children, yes.
Nutrition supplement that is provided to pregnant women and children. So just to let you know that it is connecting a world of 140 million Anganwadi centers, units, 140 million. It covers 1.3 million Anganwadi workers, and it connects 99 million beneficiaries.
That is indeed
so the
a massive
public
network.
health on scale
Yes.
and with quality and with transparency is what is our unique selling point, I would say USP for us. And that's why it is so important that in the global system, as we meet challenges of the day and future challenges of infections and non-communicable disease, climate change related issues, and indeed equity, we have offerings to make to the, and medical value tourism. We can come back to that as well.
Yes.
We have the offering as well as high-end offerings of digital health records, digital health identity, digital health folders.
Right.
So it's the size and the span and the depth, the three-dimensional capabilities
Yes. When we talk
are
of
enormous.
digitization in healthcare, the place where we are standing right now, Rome was not built in a day. But then when we're talking of challenges, implementation was the biggest challenge when we talk of digitization of healthcare. It is not just for the medical professionals to be tech driven on one side, but on the other hand, on the other side of the computer or the phone, we also need to have digitally literate population for the digitization of healthcare to be successful. How challenging was it to ensure that digitization of healthcare reaches equally to the rural areas as well as it was successful in the metropolitan areas?
Yeah, I mean, I'd say it has been a very good learning experience in terms of how we are rolling out the digital health solutions in the country. So when you see that today there are more than 72 crore Aabhas, the health IDs that have been created, and this includes both rural and urban areas. And at the same time, more than 47 crore health records have been created that have been linked to the ABDM system. So now what is happening is, whenever the beauty of technology in these days is it is very, very user friendly. It actually enables even the end user to be able to use it. I mean,
Yes.
some things like simple things like UPI. I mean, there's no separate training session any one of us have taken on how to use an UPI application to transfer money. The application is simple. So our focus has been to ensure that the applications that we are developing are user friendly. The messages that are sent to the citizens are clear in terms of what is a health record, how do they access their health record, how do they share their health record. Also, what we are doing is we are trying to make sure that we create value for everybody who is participating in the ecosystem. There has to be value for the physician, the doctor who is seeing the patient when the things are digitized. I mean, what is the addition that he is getting by moving from a paper-based system to a technology-based, computer-based system, for example. Similarly, the patient also should be able to see a perceptible change whenever he is going to a digitally enabled facility. If he is going to, let's say, AIIMS, and that AIIMS is digitally enabled, what is the advantage will he find? Will he have to wait lesser in the queues? Will he get his receipt instantly the moment the doctor prescription, the moment he writes it? Will he not have to stay in the queues for longer for giving his samples? So these are the kind of changes, and trying to give them in a way that it is easily understood and usable. And of course, training and information and communication and IEC is also a very, very important aspect to tell the larger population about the benefits of using digital technologies.
So you will add to it?
Indeed. I think for us, for such a large nation, a nation which is going through demographic transition as well as epidemiological transition from communicable diseases to non-communicable diseases, a nation which is building its universal healthcare system, it's an essential imperative. We have established 179,000 health and wellness centers, which together constitute the primary healthcare bedrock of our nation. At all these centers, in typically one such center for about 3 or 4 villages, about 6,000 population, there is a telemedicine hub which is functional. My community health officer and my ANM can discuss the problem with the patient who comes there. Doesn't have to be, they can walk because it is so close to people. And a teleconsultation in a systematic way can take place with a specialist in a medical college or a district hospital as the protocol suggests. Look at the footprint it has. Okay?
Yes.
Give you another example and a necessity. Particularly going into future, India's problem is non-communicable diseases, hypertension, diabetes, chronic kidney disease and so on. The key to address that is to prevent. Primary prevention, if not, detect the earliest manifestation of, let's say, hypertension and treat so that the heart is not damaged. How do we do that? We can only do that through primary care system, and we can only do that systematically using a system like Aadhaar ID and electronic health record to track this individual across the life course. So this is the way it's going to revolutionize. We are in a position to track every newborn baby now practically throughout his or her life, all the way for 90 years or 85 years that the lifespan of the future Indians would be. That is the strength of the way digital health system has evolved, and we offer to the world that multidimensional health system. In any case, even for the hospitals, wherever they are, those digital systems that are being created for other hospitals are also being created on India's soil, by the way. And we are of course using it for our nation, as you heard. But also remember, I'm emphasizing it again, that a lot of digital health products that other nations are using are being created in Hyderabad and Bangalore and India. So we offer as Vishwabandhu, as a friend of the nation, as a very well-meaning society, that these digital health technologies are available. Take them. We had offered COVID to all the nations at some point, and all other offerings are also available. We are constantly refining them, reducing duplication, improving quality, and this quest will go on.
All right. So that aptly sums up the future of digital healthcare in the country. Very quick, there is paucity of time. Your closing comments on this. How do we see the future of digital healthcare in the country?
I think
added to what Sir said.
I think like what Sir said, the future of digital healthcare in the country is very bright, with citizens getting the best of the services wherever they are, irrespective of their socio-economic condition, and also whichever part of the country they are, and in a very, very seamless manner. And I think going forward, our doctors, our physicians will benefit a lot by the digital technologies, the research, the innovations, and the startups that are coming up in this sector, and they will be able to provide services in the best of possible. And the ultimate goal is that even the person in the farthest, remotest part of the country, the most socially economic backward person, should be able to get the best kind of quality care that we are able to give in our best institutions. And digital health can make this possible.
All right. So on that note, we'll end this discussion. Thank you so much, Dr. Paul and Mr. Gopal, for joining us this afternoon on Wellness Watch. So both our guests help us understand more on digital technology impacting healthcare. And digital technology has a transformative power that eclipses the capacity of any other force behind earlier socio-economic revolutions. In healthcare, digital technology is creating a quantum shift, one that could transform healthcare in India almost beyond imagination. As the country continues to make progress in improving healthcare access and outcomes, it is hoped that more people will have access to quality healthcare services regardless of their location or socio-economic status. On that note, we'll end this edition of Wellness Watch this afternoon. Thanks for watching. Bye-bye.